into this natural birthing for quite some time, and you are really creating a difference in that field, and that's what we're going to talk about today. So what is this natural birthing? Like a basic adu enna, so that viewers can understand.
So natural birthing is the end result of a labor that starts spontaneously, progresses without any induction or augmentation, and you have the outcome of a healthy mother and a healthy baby at the end of everything without even surgical intervention, including things like episiotomy and things like that, right? So the end result of such a birth is called a natural birth.
நீ சொல்றத பார்த்தா like no medications, IV line கூட கிடையாது.
No. IV line we do keep a Venflon on for sure. We don't give medication unless absolutely required. We don't run IV fluids routinely. We don't give in, like I said, routine augmentation of labor கிடையாது. Things like that. And
so basically to speed up the process of the labor, we don't do anything.
Absolutely. So natural birth அப்படின்றது is the end result of a labor that starts spontaneously, right? A spontaneous labor that progresses normally. எந்த ஒரு medication for induction or augmentation எதுவுமே கொடுக்காம resulting in a healthy mother and a healthy baby at the end of the process without any surgical intervention also. So including things like episiotomy and things like that, right? Okay. So that's what we call as the end result is called a natural birth, which you can really call a natural birth only after the process is over.
Right. Okay.
Because until then we never know.
Okay, so no episiotomy kuda possible. Absolutely. To have a normal vaginal delivery.
Absolutely.
Correct. I think PG time la irundhe it has become like a normal delivery nale we tend to do, we give episiotomy.
Yeah.
But அந்த episiotomy இல்லாம tear இல்லாமலையும் it is possible.
Absolutely.
Okay. So natural birthing அது ஒரு term.
So hypnobirthing is a technique which helps them alleviate these concerns, and at the same time it's found to be remarkably helpful in shortening the duration of labor in many cases. Okay. In many cases the what a birth as such எல்லாருமே வந்து ஒரு மிக்ஸ்ட் ஒப்பீனியன் கொடுப்பாங்க சம்டைம்ஸ், ரைட்? இதெல்லாம் வெஸ்டர்ன் டேட்டா, நம்ம ஊரில் இந்த மாதிரி எல்லாம் நம்மளுக்கு டேட்டா கிடையாது. இந்தியன் செட்டப்பில் நீங்கள் லைக் ஹவ் யூ ஆஸ் நோ இந்தியன் எத்னிசிட்டிக்கு இது வேற, right? Our bodies are different, our babies are different.
And water quality?
Yeah, water quality, of course. I mean, those things have to be standardized. All that is based on, the institution that's providing it will have to ensure that all those measures are met up to.
Right. Hi, hello, vanakkam. இன்னைக்கு Smart Talksல we have a very interesting guest, an obstetrician and gynecologist who's got a vision to empower women through her natural birthing experience. So I'm so happy to welcome my friend and an amazing obstetrician, Namritha.
Thank you.
Hi.
Thank you. Hi.
Welcome to Smart Talks. Hi. இதோட ஸ்டாப் பண்ணு, இதுக்கு மேல இந்த எபிசோட்ல அக்கா வந்துச்சு அவ்வளவுதான். Okay, so welcome. I think of course we know each other for so many years. இதான் ஃபர்ஸ்ட் டைம் நம்ம சீரியஸா உட்காந்து, இல்ல இன்னைக்கு கூட சீரியஸ் கான்வர்சேஷன் வேண்டாம், ஜாலியா நம்ம பேசலாம். ரெண்டு ஓஜிஷியன்ஸ் வந்து ஜாலியாவும் பேசலாம் அப்படின்றது நம்ம இந்த பாட்காஸ்ட்ல காமிக்கலாம்.
Correct.
Right? So Namritha, I think you are into this natural birthing for quite some time, and you are really creating a difference in that field, and that's what we're going to talk about today. So what is this natural birthing? Like a basic adu enna, so that viewers can understand.
So natural birthing is the end result of a labor that starts spontaneously, progresses without any induction or augmentation, and you have the outcome of a healthy mother and a healthy baby at the end of everything without even surgical intervention, including things like episiotomy and things like that, right? So the end result of such a birth is called a natural birth.
நீ சொல்றத பார்த்தா like no medications, IV line கூட கிடையாது.
No. IV line we do keep a Venflon on for sure. We don't give medication unless absolutely required. We don't run IV fluids routinely. We don't give in, like I said, routine augmentation of labor கிடையாது. Things like that. And
so basically to speed up the process of the labor, we don't do anything.
Absolutely.
So naturally let it happen.
Yes.
The way it has to happen.
Yes.
Okay, so in the natural birthing அப்படின்ற ஒரு concept, what is that?
So natural birth அப்படின்றது is the end result of a labor that starts spontaneously, right? A spontaneous labor that progresses normally. எந்த ஒரு medication for induction or augmentation or எதுவுமே கொடுக்காம resulting in a healthy mother and a healthy baby at the end of the process without any surgical intervention also. So including things like episiotomy and things like that, right? So that's what we call as the end result is called a natural birth, which you can really call a natural birth only after the process is over.
Right.
Because until then we never know.
As in case in the middle, if you take them for emergency cesarean or whatever it
emergency cesareans, including episiotomies by itself, intervening, you can never really say for sure this is going to be a natural birth until the whole process is over. Then we say yes, now we've had a natural birth that has occurred.
Okay.
So yeah.
Okay, so no episiotomy kuda possible.
Absolutely.
To have a normal vaginal delivery.
Absolutely.
Correct. I think PG time la irundhe it has become like a normal delivery nale we tend to do, we give episiotomy.
Yeah.
But and the episiotomy illama tear illamaliyum it is possible.
Absolutely.
Okay. So natural birthing adu ஒரு term. So when a mother comes for delivery, ஒரு birth plan அப்படின்னு நம்ம சொல்லும் போது we give them these choices இல்லையா? That is if they say they want to go for gentle cesarean section or natural birthing, we give them the choice. And in the delayed cord clamping எல்லாமே comes in the choices.
In that,
at the same time you do counsel them and tell them that இதுதான் risk, இதுதான் benefits, husband கூட இருக்கணும்னா this is the thing and all of that. So so a lot of times, so now there is so much of content on social media to have exercises for normal delivery. இதை சாப்பிட்டா normal delivery ஆகும், இதை பண்ணாதீங்க normal delivery ஆகும். So much, right? So what are, like, I've heard of these names, right? Lama's classes and all of that. What are these classes?
Yeah, so these classes are primarily childbirth education classes because when we have 9 months of time, why not educate mothers on what a normal pregnancy should look like, right? What a vaginal birth is like, what a cesarean section is like. These are educational and informative classes so that mothers understand what is happening to their bodies and how they want to birth. Ultimately, it is really the mother's decision on how they want to
deliver.
Absolutely, right. Absolutely. So Lama's classes helps them prepare themselves for birth. இது வந்து for couples it's only for the we like to include couples because ultimately in the they labor room also know. Absolutely they should because know. Half the time they don't know when we say first trimester, second trimester சொன்னாலே தெரிய மாட்டேங்குது உங்களுக்கு. So this includes the basic knowledge of all that. Absolutely. So you understand what pregnancy is, what the different trimesters are, what happens in the theory of all of that, and then in addition we also start towards the third trimester, we start training them towards birth. Right? So what are the coping mechanisms when they are in labor? Maybe things like hypnobirthing, right? Which breathing techniques, right? That may help them in labor. What are the other pain coping strategies? We also teach them things like massages, right? So educators will teach them about different massage techniques. How the partner should give massage for the mother when she is in labor. Yes. Right. Yes. So we take them through all of that, and I think that keeps them mentally prepared for what to expect in labor. Otherwise, most often what happens is people come in for admission and then are just completely clueless, not knowing what is going to happen next, how long is this going to take. All of that also builds the anxiety in the couple. Yeah. So I think this really helps them through that, and it also helps the partner to be extremely supportive of the laboring woman. So nariya classes irukla Namritha. I mean online la there are so many classes for this. நம்ம சொல்லும்போதே நமக்கே ஒரு மாதிரி இருக்கு because there's so much content. But honestly, you tell me in your opinion, இதெல்லாம் வந்து ஆன்லைன்ல முடியுமா? They have to come in person. Do you think it's got a better impact? It depends. For example, suppose this particular mother needs physiotherapy. Right? They have some concern like pelvic girdle pain, things like that. This is not something that can be assessed online. It's like a clinical visit. You need to see the physiotherapist in person, assess it, and then recommendations are made. Right. Maybe routine pregnancy yoga, antenatal yoga, right? Or maybe routine childbirth education classes, which are generalized for the general population, sure. But in special circumstances, things will change. So in that case, I don't think this one rule applies for all situation
All.
works.
Yeah,
No.
yeah.
No.
So it's better they go in person and at least once to see what their body is like.
Yeah.
இல்லையா?
Yeah.
Okay, so natural birthing பத்தி பேசணும். Gentle cesarean section பத்தி நீ சொன்ன. Hypnobirthing you mentioned in the middle இல்லையா? So என்னது இது hypnobirthing?
So hypnobirthingன்றது ஒரு technique by which mothers are taught by trained professionals how to visualize what they want their labor to be, how to incorporate the mari breathing techniques along with that. This helps them right through the latent phase, first stage, second stage of labor, and it helps the mums to relieve them of any anxiety or fear that they may have. Right? It's
Fear
it's
of
almost
pain, you mean?
Absolutely. Even the process of birth itself, even going to a hospital,
Yeah,
sometimes
yeah.
for some mums,
Yeah.
it seems, they keep saying
Scary.
it's scary for them. So, hypnobirthing is a technique which helps them alleviate these concerns. And at the same time, it's found to be remarkably helpful
Yeah.
in shortening the duration of labor. In many
அப்படியா?
cases,
Okay.
in many cases, people who have gone through good specialists, right, who have trained them in this, they do wonderfully well in labor.
Okay. So basically hypnobirthing is breathing to
Breathing and
help in,
visualization as well.
Pain
They
relief.
visualize their labor, right?
So that has to be done only by a specialist trained in
There are
hypnobirthing.
people
Not
trained in
anybody
that.
can do it. And also
It's not easy to do it. It's not easy to teach
and
someone
they'll
to
be
train
with
their
them
mind.
during labor. They'll be with them during labor.
Not necessarily.
Not necessarily.
Not necessarily.
Okay.
If they're trained enough, because it's a quality of training your mind to
Right,
it, right?
right.
So to be able to visualize yourself in labor, to visualize the birth of your baby,
Yeah.
to be able to understand to how you incorporate these breathing techniques, I think all of that. If they've been trained well, nobody else needs to be in the labor room. The
okay.
mothers are perfectly comfortable to
Okay.
do all of this by themselves.
Right. So if the hypnobirthing is not a tool for normal delivery. Hypnobirthingல cesarean நடக்கலாமா?
Of course, cesareans can happen with anything.
இல்ல ஏன்னா வந்து there are patients who come and say, I want to opt for hypnobirthing. They have no clue what it is. At the same time, they think that's what is going to take them for normal delivery.
There is no sure short way of saying I'm going to have a vaginal
Have
birth.
you had
That's why-
patients who will come at the first appointmentலயே வந்துட்டு
weeks.
6 weeks 7 weeksலயே வந்தோடனே சொல்லுவாங்க நார்மல் டெலிவரி பாசிபிள் அவங்க கேட்க மாட்டாங்க அவங்கள விட அவங்க கூட இருக்கிறவங்க தான் கேட்பாங்க
Yeah.
and they don't understand right that it's not possible for any obstetrician to say that right so until otherwise there is a clear cut contraindication for normal delivery இல்லையா so I think this they need to be very clear.
Correct.
Okay, so நம்ம வந்து natural birthing கேட்டுட்டேன் gentle cesarean கேட்டுட்டேன் hypnobirthing கேட்டுட்டேன் இன்னொன்று ஒன்று பயங்கர ட்ரெண்ட் ஆகுது ஒன்று வாட்டர் பர்த் ஓகே நம்ம இந்தியன் செட்டப்பில் அஃப்கோர்ஸ் நிறைய இடத்துல இட்ஸ் ஹேப்பனிங் இட் நீட்ஸ் டு பி சர்டிஃபைட் அண்ட் so many things are there legalities but how safe is it?
So water birth அப்படின்னு சொல்றது there are two components இல்லையா ஒன்று வந்து water immersion in labor that is நம்ம early laborல first stage okay then people using water as a form of therapy right
For pain relief.
for pain relief right so that's one way of and that is universally recommended.
Oh, so basically water immersion is till they deliver, till they become fully dilated. அந்த வாட்டர்ல இருப்பாங்க அப்புறம் fully dilated ஆனா தூக்கு நேரா போய்
So water immersion there is absolutely no doubt about the fact that it is advantageous. It is a very advantageous thing and universally there are also like guidelines and everyone supports the idea that water immersion can be used as a pain relief therapy. Absolutely.
Right.
And mothers are very comfortable in it. Couples are very comfortable in it. Sometimes the partner joins them as well. So the water birth as such எல்லாருமே வந்து ஒரு மிக்ஸ்ட் ஒப்பீனியன் கொடுப்பாங்க சம்டைம்ஸ் ரைட் இதெல்லாம் வெஸ்டர்ன் டேட்டா நம்ம ஊர்ல இந்த மாதிரி எல்லாம் நம்மளுக்கு டேட்டா கிடையாது இந்தியன் செட்டப்ல நீங்க லைக் ஹவ் யூ ஆஸ் நோ இந்தியன் எத்னிசிட்டிக்கு இது வேற right our bodies are different our babies are different
and water quality
water quality of course I mean those things have to be standardized all that is based on the institution that's providing it will have to ensure that all those measures are met up to but do we have enough evidence to say that babies in the Indian ethnicity also have done well in water births? Absolutely. I think there are institutions across India that have been doing water birth for a very long time. அவங்களே வந்து studies and publications எல்லாமே பண்ணிருக்காங்க and they've had very good outcomes. So I think we should go with that when we are talking about something, instead of generally talking about it across the world. Westla they're doing this. I think it's more important to look at Indian case studies, Indian publications and institutions where they've supported it and have had good outcomes. So then, so again, it depends on whether your institution is able to support it. Do you have the infrastructure for it? Are all the safety measures being carried out? Do you have the labor force that's ready to work, in such a setup?
Trained in it.
Absolutely. Trained midwives and obstetricians together, right? Like a collaborative care model. If that is there, why not? Absolutely.
Awesome. I think another thing that I want to tell you is VBAC. எல்லாருக்குமே இப்போ விபேக் பற்றி தெரியும், வெஜைனல் பர்த் ஆஃப்டர் சிசேரியன். ஸோ சிசேரியன் ஆனால் நெக்ஸ்ட்டு டெலிவரி வந்து சிசேரியன் தான் ஆகணுமா? அஃப்கோர்ஸ் கான்ட்ரா இண்டிகேஷன்ஸ் இருக்கிறவங்க, பிளாசண்டா ப்ரீவியா, ஆர் இஃப் இட்ஸ் அ ப்ரெஷியஸ் பேபி, ஆல் தட் இஸ் ஃபைன்.
All babies are precious.
All babies are precious. Absolutely. But then ஒரு fertility specialist கிட்ட கேட்டினா
all babies are precious. I won't accept that IVF babies are extra special.
No, IVF babies are not extra special at all. But the risk would they take for natural delivery is lesser. See, this is என்னதான் வந்து நான் மைக்க பிடிச்சி வந்து இல்லை, நான் வந்து just because the patient want கொடுப்பேன், இல்லை அது நடக்கிறது இல்லை. That's what it is. So anyways, so vaginal birth after cesarean. How can patients decide? இப்போ எனக்கு சிசேரியன் ஆயிருக்கு ஃபஸ்ட்டு டெலிவரிக்கு, இப்போ நான் செகண்ட் ஐ வாண்ட் டு ட்ரை நார்மல் அப்படின்னா என்ன க்ரைட்டீரியா இருக்குது அதுக்கு? ஹவு டு ஐ ஃபால் இன் டு தட் கேண்டிடேசி வேர் ஐ am allowed to explore that option?
So first of all, you have to go to an institution that supports trial of labor after cesarean. That is trying for a vaginal birth after you've had a previous cesarean. VBAC is at the end of it, again like natural birth, at the end of the whole process we can say yes, we've had a VBAC. We're saying we're doing a trial. So you have to have an institution and a healthcare provider that's in support of carrying out a 2 lakh. That's the first thing. Of course, routinely as obstetricians, we all know that there will be criteria by which you can consider mothers for trial of cesarean, trial of labor after cesarean. Probably one of the most common things that we see is the previous cesarean, how long ago was it, right? What kind of incision was made, right? And then what kind of incision was it? Like you said, in the pregnancy, are there any additional risk factors, right? Like you said, placenta previa, if there is a breach alongside, any other high risk factors. So we look at not only what has happened in the past medical history, but also in the current pregnancy. And if there is a very strict eligibility criteria, and mothers if they don't fall under the high risk category, there are no contraindications. There are no contraindications, and they can go ahead for a trial of labor after cesarean. There's absolutely no.
So concern. In VBAC, basically, you don't induce labor. You allow naturally.
Ideally, if they come in spontaneous labor, that's the best, of course. I mean, in VBACs, in trial of labors, we do induce not by the routine pharmacological interventions. We may use mechanical methods, preferably. At least that's what I use for a previous cesarean.
And always they are given they're always well counseled. Of course. You'll be closely monitored, and then of course uterine they will be scar rupture.
Yes, they will be given all the pros and cons of deciding for trial of labor after cesarean. They will be explained in detail. What are the pros of having a successful VBAC? What are the cons of doing a trial of labor? Things like that. And also, we'll also tell them what are the pros of having an elective cesarean also.
Yeah.
Why not? That is what informed consent is. You tell them all of this.
Yeah.
Right?
So they should be mentally ready. So ஃபஸ்ட்டு சிசேரியன் ஆனவங்க செகண்ட் நார்மல் டெலிவரி ட்ரை பண்ணும்போது தே ஷுட் பி மென்டலி ரெடி. எஸ், நார்மல் டெலிவரி ஆனாலும் ஓகே, இது வந்து எமர்ஜென்சியா சிசேரியன் போனாலும்
correct. That's the first thing. Actually, more than anything
baby and healthy mother is the final outcome.
Yeah, right? So that's the first thing we counsel them about. That when you do a trial of labor after cesarean, possibly one of the first things we can compare and contrast is in this case there is a possibility of an emergency cesarean versus in the other one it's a planned elective cesarean section. And we all know that emergency cesareans have a higher risk than planned elective sections.
Yes. So they should be well aware of that. So இப்போ வந்து ஒரு mother வந்து she has not had an active lifestyle at all. சரியா? அவங்க வந்து எக்ஸசைஸ்லாம் பெருசாக பண்ணதே இல்லை. அவங்க வந்து ஃபஸ்ட் டைம் வந்து ஷீஸ் ப்ரெக்னென்ட் அண்ட் ஷி வாண்ட்ஸ் டு ட்ரை திஸ் நேச்சுரல் பர்திங் அண்ட் டியூரிங் ஹர் ஆன்டினேட்டல் பீரியட் ஆல்சோ, ப்ரெக்னென்சி பீரியட் ஆல்சோ ஷீ டென்ட் எக்ஸசைஸ் மச் அட் ஆல். எதுவுமே பெருசாக பண்ணல, சும்மா இந்த ஆன்லைன் கிளாஸஸ் தியரட்டிக்கலாக ஷி நோஸ் வாட் இஸ் வாட். கேன் ஷி ஸ்டில் ஆப்ட் ஃபார் நேச்சுரல் பர்திங்?
Of course. See, again, because if she comes in spontaneous labor, okay, and she has had the labor has progressed normally. There's been no induction, no augmentation. Her labor has progressed normally. Yeah, of course, why not?
And the success compared to those who have gone through all that, நான் என்ன கேட்குறேன்னா, இப்போ நான் வந்து உட்காந்து எக்ஸசைஸ்லாம் பண்ணி நான் வந்து எல்லா கிளாஸும் அட்டென்ட் பண்ணிவிட்டு நான் வந்து நார்மல் டெலிவரி சான்ஸ் ஹையர், இல்லை வந்து எதுவுமே பண்ணாமல் திடீர்னு நான் நேச்சுரல் பர்திங் பண்ணுற லேபர் போகணுன்னு அப்படின்னு சொல்கிறவங்களுக்கு இந்த சக்ஸஸ் ரேட் எப்படி அப்படி கேட்குறேன்.
It's you can't
not
comment
much
on
difference.
It. Okay. Absolutely not. Absolutely not.
So in your opinion, as a team, you think midwife, doula and an obstetrician adu oru team ah irundha it really makes a huge difference?
Of course, absolutely, 100%. Definitely.
Okay.
Definitely.
Okay. So இப்போ நிறைய பேர் இப்போ see I don't practice natural birthing, but நிறைய பேர்ல டிஃப்ரெண்ட் ரிக்வெஸ்ட்ல வராங்கல்ல, இந்த மாதிரி பர்திங் இருக்கணும். அப்புறம் வந்து சில பேர் என்ன கேட்டிருக்காங்கன்னா வந்து ஐ வாண்ட் டு வீடியோ டேப், ஐ மீன் த அல்ட்ராசவுண்ட் எக்ஸ்பீரியன்ஸ் உள்ள வரது எடுக்கணும். சில பேர் சோஷியல் மீடியாக்காக அதாவது எல்லாமே சிசேரியனா இருந்தாலும் ஃப்ரம் த டைம் யூ புட் தென் so many requests have come, right? So what is the most unusual request you ever got?
Most unusual
or weird or funny?
Okay, I don't
வந்து சரி இருங்க நான் யோசிச்சு சொல்றேன்.
I can think of அப்படி யோசிச்சு சொல்லணும்னா maybe I can say one of the most unique and probably less practiced things that I have ever had to do is probably a lotus birth.
Lotus birth? Okay. So இப்போ வந்து there's so much of this natural birthing content online, and then at the same time traditional obstetric practice also is going on. So idu eppadi, how do you think we can, because holisticavum venundranga patients, at the same time they don't want to let go of the touch of the traditional practice also. Of course each patient individualized da irukku. So idu eppadi you think to obstetricians itself, obstetrician and gynecologist eppadi balance pannalam? What do you think?
Actually, it's fairly simple for obstetricians to balance this out because as the requests are changing and as newer and newer evidence is being collected, we have enough supportive guidance, right across international bodies to tell us that இதை நம்ம சப்போர்ட் பண்ணலாம், ரைட்? இட்ஸ் கான்ஸ்டன்ட்லி இவால்விங். ஒரு 10 வருஷத்துக்கு முன்னாடி இருந்த கைட்லைன்ஸ் கிடையாது இப்போ 2023 2024ல இருக்கிறது, ரைட்? So the guidelines also are evolving. They are also saying, okay, please start looking at newer evidence, right? Look at newer materials because so much research is going on in this. So அதுவும் பார்த்து when we have recommendations changing for obstetricians as well. So I think as long as we can follow through with that, we are reasonably safe in saying that we are evolving with time, right?
So obstetricians nammalum konjam and we should update ourselves
kandipaga because they are saying
upgrade ourselves.
Yes, they are saying be supportive of your mother's wishes, right? Respect their choices, right? Just because you feel that one particular way is the way to go does not mean that you can push that onto
for everyone.
Absolutely. So you have to respect people's choices. Of course the basis is safe evidence based obstetric practice. Adula endha matram kadiyadu. But for it, when we have further evidence to show that all of these things are possible in a birth, then I think we should carry it out. We only do things based out of evidence based medicine, and there's enough evidence to support this kind of care. So I think the only way for us to evolve is to follow through with the recent changes.
Yes. Correct. Upgrade ourselves.
Absolutely.
Okay. So unoda practice la you feel like after so much of information that's available, the trend is like people are asking for this options more?
Absolutely. Definitely I do see that probably because of social media. I do see a lot of women come in asking about all of these things, Lama's classes, what is hypnobirthing, all of these questions that you had. A lot of people come asking regarding the benefits of all of this. They want to try and ensure that they can do the best they can during the antenatal period to ensure that they have a smooth birth. So there are a lot of people who come and
So see, one more thing, சோஷியல் மீடியாவில் வந்து அஃப்கோர்ஸ் செலிப்ரிட்டி மக்கள் நிறைய பேர் வந்து ஆர் ஆல்சோ அட்வொகேட்டிங் திஸ்ல. அது வந்து in a way it's good, in a way it's I don't know what. So what do you think about that? Got a positive impact. Inspiring
Social media yeah, so celebrity couples or celebrity moms who have had one particular type of birth may be promoting it heavily, but in regular practice, if you see, there are mostly it's non-celebrity moms. There are so many of them having the same experience.
Correct.
Right?
But
It's just that they have a large reach, right?
Yes.
Which is often a double-edged sword in a Puerto Rico, because sometimes it can lead women into misunderstanding. Or comparing their births and thinking I should have the exact same identical experience.
Right.
Every birth is unique.
Yes.
Every labor is unique, right? So we shouldn't remove that uniqueness from it, by trying to say this person had this particular thing and I'm going to have an identical birth.
Correct.
No one's going to have an identical experience of birth.
Absolutely. Even
let's not set unrealistic expectations.
Exactly. I do tell my patients too that if they come, especially with the reference, if they come and say, na idu paatha, every pregnancy has its own story. Every birth is a separate own unique story, right? Nice. Okay, Namu. So, now we are moving to the rapid fire round. இதுக்கு வந்து நான் ஸ்மார்ட் ஷாட்ஸ் அப்படின்னு பேர் வச்சிருக்கேன். ஓகே. ஸோ இது எல்லாமே வந்து ஒன் வேர்ட் ஆன்சர்ஸ் ஆர் குவிக் ஆன்சர்ஸ் தான்.
மேக் them simple.
I'll try. Okay. Epidural anesthesia or no epidural?
As a personal experience or as an obstetrician's recommendation?
Anything. As an obstetrician.
No epidural.
No epidural. So I know this is one word, but then epidural anesthesia is basically they want to not have the pain, right? Absolutely. During labor. So why no epidural?
So I'm saying no epidural because specifically you're dedicating this one to natural birth, right? That's why we're here to talk about this. And there, for sure, an epidural is an intervention,
right?
And
so
if there is
does it delay the labor process?
There is a chance of increased intervention because of epidurals. There's no doubt about it. So that's mainly why I'm saying. In reference to natural birth, avoiding an epidural may be more ideal because sonna mari, once you have an epidural, you can't say it's a natural birth anymore because you have your IV fluids. You have to have all that support.
Right.
I need to give you fetal monitoring. Has to be there. Anesthetist has to be there. So that's far from natural.
Because why? Na ye the kekrana. I've had patients who will come and say, I want natural birth, I don't want any intervention. As soon as the pain starts, they'll say, no, in epidural கொடுத்துருங்க அப்படின்னு சொல்லுவாங்க.
Sure.
Then when they end up in a cesarean, they'll say, why did I end up in a cesarean? That could be many reasons.
Correct.
But just
correct. No, I mean an epidural by itself may increase the chance of intervention. Yeah. But at the end of it, that's the problem with the word natural birth. It can mean so many things.
So only at the end of it.
Very specifically, they say, what do you want to avoid? You want to avoid episiotomy? Let's be specific about that and say that. Right? Don't use a generalized loose term because natural birth can mean a lot of things.
Got it. Okay. Night owl babies or early risers?
We all love early risers, but
never happens.
Yeah, it never happens. Night owl babies are very special.
Okay. Natural birth or gentle C-section?
Natural birth. End outcome of a natural birth, like I said.
No problem. Not a personalized opinion. It's okay. Water birth or hypnobirth?
Hypnobirth.
Nice. What is the most underrated birthing technique?
I think it has to do with positions. I think mothers do very well in the all four positions.
You really
advocate for that. Yes.
Okay.
Yes.
So what is that all four position?
So the mothers, typically, if you see in a hospitalized setting, we have them in a lithotomy position. This is the classical way in which they lie down on their back and their legs are put up on stirrups or whatever. This is maternal positioning where the mothers are on their knees, right? And they are supported all four positions. And of course, I think the outcomes are wonderful with it. So yes, nice. That's my recommendation. Yeah.
Right. Okay. Super. Fact or myth? Seriya. Laboring in water reduces the intensity of contractions. I think you already said the answer.
Absolutely.
Fact. Okay. Natural births are always less risky than C-sections.
the end outcome of a natural birth is less complicated, has less adverse effects than a cesarean section. Absolutely. If you have
So
the
fact?
natural birth, yeah, absolutely. The fact.
Okay.
The fact.
Eating certain foods can naturally induce labor.
Myth.
Myth. Okay. Walking helps speed up labor.
Fact. Definitely.
Yeah? Okay. It's normal to have a birth plan, but 90% of the plans go out the window once labor starts.
No. Myth.
Myth.
No.
Super.
You have a birth plan that includes everything, including your plan for what happens in case of an emergency cesarean.
Yes,
Things will
we
go
stick
your
to
way.
it. Super. Okay, choose the right one, Seriya. For a smoother labor, warm baths or birthing ball exercises.
Combination.
Choose the right one. So, no one தான் choose பண்ணு.
Combination.
Okay, for pain relief, breathing techniques or medication.
Combination.
யோசிக்கும் போதெல்லாம் எனக்கு ரொம்ப ஹாப்பியா இருக்கு. சரி நம்ம கரெக்ட்டா क्वेश्चns ஃப்ரேம் பண்ணிருக்கோம்.
Combination. Breathing techniques.
Combination.
Absolutely.
What kind of answer is that?
Because
I need you to choose one.
Because it should never. That's the thing. We should never have to have your mother say, "I have to choose only this or this." Pain is different for everybody. Breathing techniques, and then after that, if you still want pain medication, go for it. Have everything available for you.
Done. In the delivery room, silence. எல்லாரும் அமைதியா இருங்க. அவங்களுக்கு வந்து ஸ்பேஸ் கொடுங்க. பேசாம இருங்க. இல்ல சமயம் மியூசிக் போடுங்க.
Maternal choice, but music in the labor room for sure.
Yeah? Abdiya, you've had any special requests from patients and all?
Many. And it varies, right? From it depends on the stage of labor, and it depends on how the mother is feeling at that point of time. So if they're feeling high on energy, then they'll be snacking on something, and they'll be sometimes I've even had mothers dance to some kutta songs and things like that in labor. But then things change, and it's wonderful to watch that change, that transition.
That time,
Because from that they'll probably go into really slow, relaxation, meditation music that really helps them focus. So that has happened. And then we also have people who maybe towards the second stage will play something that will
be more calming, soothing.
Both. We've seen both. We've seen some people who picked calming things. Some people have picked like really songs like Push It. I think one of the husband played that for one of the mothers.
Push It.
Yeah.
இது நல்லா இருக்கு.
And she was laughing throughout her second stage. So
what would, if I would give you a choice of your playlist, Namritha, உன்னோட லேபருக்கு ஒரு பிளேலிஸ்ட்னா?
I think my favorite so far.
English part தான் சொல்லுவா. 100%.
Okay, Coldplay season. So Fix You by Coldplay. I think that would probably be my favorite labor song that I have heard also. Yeah.
Okay, but this Push It sounds very interesting.
Push It is fun. I thought it was hilarious when I was in the labor room. After the whole birth was over, I told the husband, well chosen.
Nice. Whatever helps her.
Yeah.
Okay. Last question. Post birth, skin to skin contact or immediate measurements of the baby?
Skin to skin contact.
So what is this skin to skin contact, and what do you think are the benefits of it?
So the skin to skin contact is where your baby, instead of being taken away right after birth, for examination by a neonatologist or anything, instead the baby is put onto the mother, right? I think this really helps because the warmth really helps. It encourages maternal and baby bonding. It's very helpful, and this is not only done for vaginal birth, like you said in the gentle cesarean section. That's something that we focus on.
Yes.
Instead of taking the baby away.
Cesarean itself, we do focus on that.
Yeah.
And the fathers also.
Yes, the fathers also can do skin to skin.
Yes.
And it also promotes early breastfeeding and initiates breastfeeding. So huge advantages. So definitely skin to skin.
Yeah?
No taking the baby away unless we have concerns.
Yes. Okay. That's the end of the rapid fire round.
Great.
Yes. Okay. So we come to the end of this podcast. I think இப்போ பார்க்குற இந்த வீடியோ பார்த்துருக்குற ஆடியன்ஸ் எல்லாருக்குமே the core of natural birthing, how to bring out the beauty of birthing. They don't have to be scared of it. You can go through pregnancy, you can go through labor also in a beautiful way, which will make you feel empowered, confident. You can talk about it without feeling traumatized. அப்படின்ற ஒரு விஷயம் I think they would have got from this, and a lot of insights also as to what is new. So thank you so much
Thank
for
you
coming.
so much. Thank you.
Yes. I hope you had fun.
Yes, I did. Thank you.
Yeah?
Thank
Okay.
you.
Done.